Hello my dear students, I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for last 25 years and I love it. Today we're going to talk about the Norma Frontalis. So, which means the skull as viewed from the front. Okay. A student will always ask this question. So I don't blame you for asking it. Ma'am, why should we study the normas? What is the use of studying all this? The answer is very simple, my dear friends. A student who knows the bones of skull knows the head, face, neck region. That's the simple logic to it. And that's the reason why you need to study Norma Frontalis or any other norma for that matter. In fact, I'll advise you, study your normas, study your mandible, and study your humble hyoid as well. Okay, and ensure that you know these bones. You will be surprised how easily you will know your head neck region. Alright, so let's now begin with a viva question. Okay, see if you can answer it. What are the bones forming the orbit? The bones forming the margins of the orbit. Okay, or else, what are the structures passing through the infraorbital foramen? What are they branches of? Or what are the muscles attached to the outer surface of mandible? These are all very simple viva questions. But to be able to understand and answer these questions, you need to know Norma Frontalis, okay, which is the skull as viewed from the front. Are you ready for it, students? Let's begin then. Right. So, let me keep this away. Give me a minute. Right. So, bones forming the Norma Frontalis. Let's take a look. Here in the front is your frontal bone. Okay, I'll suggest you feel it on your own skull, or if you have a skull with you, feel it there. Here is your frontal bone. Here are the two nasal bones right here on top of your nose. On the side forming the beautiful cheekbones, the zygomatic bone. Here in the front, the two maxillae, and here below, the wonderful, only mobile part of your skull, the mandible. Okay, so these are the bones that are forming the Norma Frontalis. If there are bones held together, right, then they have to be held together by joints. In case of skull, those joints are called as sutures. So let's take a look at the sutures. Come back to the screen here. See, your frontal bone will articulate with different bones and it will form fronto something joint. Okay, so here it's articulating with nasal bone, with suture, frontonasal suture. With maxillary bone, fronto-maxillary suture. With zygomatic bone, fronto-zygomatic suture. You understood? There is a very simple logic to it. Right. Here in the middle, the two nasal bones articulate internasal suture. When the zygomatic meets the maxillary, zygomatico-maxillary suture. And here in the midline, you can see a suture that you have not seen commonly. That's the metopic suture, seen in about 6% of the individuals. Okay. So, what are the sutures you saw? Frontal bone with the nasal bone, frontonasal, frontomaxillary, frontozygomatic, internasal, zygomatico-maxillary, and the metopic sutures. So, you saw the bones, you saw the sutures. Let's go forward then. Now, to understand Norma Frontalis, students, you need to understand it in such a way that grasping is easy. I can just dump information on you, but that's not the point, isn't it? So let's divide this into small bits that we will study as bits. Okay. So here will be the upper part, which means our forehead. Okay. Then will be the orbits. Then will be the anterior nasal apertures. We will study these individually. Then below the anterior nasal aperture, we call the whole thing as lower part, which we will divide into zygomatic bone, anterior surface of maxilla, and the mandible. So we are going to divide our class into 6 small bits and study them. I think that will help you to grasp it better. So let's go to the upper part or the forehead part. Okay. Obviously, which bone is forming the forehead part, students? Of course, it's the frontal bone. Okay, this is the whole thing is the frontal bone. You can see that the frontal bone is uniting with the nasal bones here at one point which is called as the nasion. You can feel it on your skull as well. on your own self. The point is called as the nasion. Above your supraorbital margins, you will find two arches here. Feel them? These arches are called as superciliary arches. And the point where they meet in the midline here, there is a little prominence which is called as glabella. What is it called? It's called as the glabella. Now run your hand above till you come to two prominences on your skull. Can you feel them? Yes. Each of these prominences is called as a frontal eminence. What is it called? Frontal eminence. Frontal eminence is quite prominent in the females, however much less prominent in the males. Here you can see a bit of the frontal bone that has gone inside the orbit, helping to form the roof of the orbital cavity. This plate is called as the orbital plate of frontal bone. Now let's come to another part of this. The upper part of your skull not only has these features, it also gives attachment to three muscles. Let's take a look. Above your nose, a muscle called procerus. Please repeat it. Okay, what is it called? It's called as procerus. Over here, you have a muscle called corrugator supercilii. Please stop and look at me. Now use your muscles to frown. Get mad at me. Frown at me. Okay? This frowning action is produced by procerus and corrugator supercilii. They help you to create these vertical creases on your forehead by corrugator supercilii and horizontal creases by the procerus muscle. Okay? Also, you find one more muscle attached here, orbicularis oculi. Tightly close your eyes. Pretend you don't want to see me. Close your eyes tightly. This is orbicularis oculi. Okay? It will take origin from the surrounding region and help to close off your eyes. Okay? So, which three muscles did we see? Procerus, corrugator supercilii and orbicularis oculi. Students, my advice to you is, you say these things as I teach you. Otherwise, just hearing it is not going to result in any kind of learning for you. Okay? So, try and just accept that this is the way it is and repeat it with me. Okay? So, let's revise upper part. It was very easy. You saw how it consisted of nasion, superciliary arches on either side, glabella here, frontal prominences here. Okay, this is the orbital plate of frontal bone, and you saw three muscles attached here. They were P for procerus, C for corrugator supercilii, and orbicularis oculi. Three muscles. Try and remember them. What does procerus do? Horizontal creases on your nose. Okay. Corrugator supercilii, vertical creases. Orbicularis oculi tightly closes your eyes. We now go to the orbit, or the study of this orbital socket. The orbit consists of a superior orbital margin and inferior orbital margin, a lateral orbital margin, a medial orbital margin. Okay, so here you can see the orbit. This is the orbit. This is the superior margin, inferior margin, medial margin, lateral margin, and this here is the cavity of the orbit. Okay. So the superior orbital margin, if you look carefully, shows presence of a small little notch here. This notch is called as the supraorbital notch. Passing through it are the supraorbital nerves and vessels. Pause. I will tell you more about it. Let's just go to another nerve and vessel just found medial to this, supratrochlear nerve and vessels. So you've learnt two terms, supraorbital nerves and vessels, supratrochlear nerves and vessels, passing over the margin into your forehead region. Significance is that both supraorbital and supratrochlear are branches of ophthalmic division of trigeminal nerve. They travel upwards onto your skull right till your vertex to supply your scalp. Another very interesting fact is supraorbital and supratrochlear blood vessels, arteries, are branches of ophthalmic division of the internal carotid artery. Now see, internal carotid artery normally supplies the interior. and external supplies the exterior of head neck region. But because of these arteries, they act as communication between these two arterial networks. Okay. Let's go further to the inferior margin, which obviously is formed, as you can see, by the maxilla and by the zygomatic bone meeting here. Just below this suture, you find a foramen called the infraorbital foramen. The infraorbital foramen is a space where inferior orbital nerves and vessels emerge out. Okay, the infraorbital nerve and vessels are branches of maxillary nerve and artery respectively. Okay, so here it was ophthalmic division, here it is maxillary division of trigeminal. Okay, now what you see is the lateral margin here, which is formed by the frontal bone and the zygomatic bone, and on the medial side you see the medial margin formed by the frontal bone and by the maxillary bone. There will be a little contribution by the lacrimal bone as well. Okay, so this is the orbit that we need to know. Let's revise the orbit quickly on the bone, students. So here is the superior orbital margin formed by the frontal bone, through this small little notch passes your supraorbital nerve and vessel, medial to that supratrochlear nerves and vessels. Inferior margin formed by maxilla and zygomatic bone. Below that a small foramen here, which is for the exit of inferior orbital nerves and vessels. Okay. Lateral margin formed by frontal and zygomatic bone. Medial margin formed by the frontal, maxilla and by the lacrimal bone. Okay. That completes the orbit. Let's now go to the anterior nasal aperture. Okay. The anterior nasal aperture, as you can see, has two bones perched on the top. These two are the nasal bones which articulate with each other and with the frontal bone. Inferiorly, they are free for attachment of the various nasal cartilages to it. On the side, the aperture is formed by nasal notch on maxilla and by the anterior nasal spine as the two nasal notches meet. Anterior nasal spine, as you can see, gives attachment to the nasal septum in the midline, which helps to divide your nasal cavity into two equal halves. This nasal septum is formed partly by cartilage, but partly it is formed by a bone called vomer and by another bone called perpendicular plate of ethmoid. Please say it once. Vomer and perpendicular plate of ethmoid bone helps to form the nasal septum. Can you see two projections on the side here? Okay, there should be three. In this particular case, you can see two projections, the middle and the inferior nasal conchae. These are bony projections below which the space is created. Each space is called as a meatus. Concha, space below it, meatus. So, middle meatus, inferior meatus are visible from here at this moment. Okay. So, what have we studied? We've studied the upper part. Okay. We've studied the upper part. We've studied the orbit. We've studied the anterior nasal aperture. What is left now? The lower part consisting of zygomatic bone, anterior surface of maxilla and the mandible. Are you okay up till here, students? Let's study the zygomatic bone. Feel your zygomatic bone. Here, this beautiful prominence of your cheek is the zygomatic bone. Okay. This is the bone. It shows a foramen right there. Okay. It's tiny little foramen which is called the zygomaticofacial foramen, through which emerges your zygomaticofacial nerve. This nerve is again a branch of, of course, it's a branch of trigeminal nerve, but maxillary division of trigeminal nerve. Okay. You can see how the zygomatic bone, that's the nerve emerging out. You can see how the zygomatic bone is giving out a projection into the orbit, which helps to form the lateral wall and floor of the orbit. Okay. It gives rise to a process that goes up, which is called as the frontal process of the zygomatic bone, this one. If you look carefully, you can see zygomatic bone giving out a process posteriorly also, which goes on to meet the zygomatic process of temporal bone and form this beautiful zygomatic arch. Okay. A number of muscles are attached to the zygomatic bone as well. Let's take a look. Can you see 3 muscles attached? Yes. This one is zygomaticus minor. This one is zygomaticus major. And this is your favorite muscle, masseter, coming from your mandible, getting attached to the zygomatic arch, helps you to chew, happy, eating food with the help of the chewing action of masseter. Okay. So, zygomatic bone. Let's revise it quickly. This is all very easy, students. It just takes you a little bit of attention to understand this. These are the 2 zygomatic bones. You can see them showing a tiny foramen here, the zygomaticofacial foramen for the zygomaticofacial nerve. It gives a process up to form the lateral margin of the orbit, meeting with the similar process of the frontal bone. It gives rise to a bit of the bone which enters into the orbit to form the lateral wall and floor of the orbit. It also gives rise to a projection posteriorly which articulates with the temporal bone. It's got 3 muscles attached to it. See if you can remember: zygomaticus minor, zygomaticus major and the masseter. So with this we complete the zygomatic bone. Let's go to the anterior surface of maxilla. What you see here in the front. Remember, we're not talking about the entire maxilla. We're only talking about the part which is visible from the front. We are doing Norma Frontalis, isn't it? So you can see that it is a somewhat pyramid shaped bone. Therefore, it has got 3 processes visible from the front. Okay. So this one process goes up towards the face, towards the frontal bone, called the frontal process of maxilla. One goes towards the zygomatic bone, zygomatic process of maxilla. One goes down to form the alveolar margin of the upper alveolar margin. This gives attachment to 8 teeth. Please revise the dental formula: 2, 1, 2, 3. 2, 1, 2, 3. 2 incisors, 1 canine. 2 premolars, 3 molars. Please tell me again, everyone. 2, 1, 2, 3. 2 incisors, 1 canine. 2 premolars, 3 molars. Okay. These are the teeth that are attached to the alveolar margin of maxilla. The maxilla also shows surfaces. It's got processes, it's got surfaces. Okay. Here is the orbital surface of maxilla again. Can you see that? A part of your maxilla is now projecting inside the orbital cavity. This bone helps to form the floor of the orbit, okay, and is called as the orbital plate. Okay, it helps to form the floor of orbit. So that's one surface. The second surface is inside the nasal cavity itself. This part where my finger is now is the nasal surface. This here is the anterior surface of maxilla, which of course shows you your favorite foramen, the infraorbital foramen, from which we know the vessels and nerve and vessels emerge. Medially, the maxilla goes on to is limited by the nasal notch, and which unite to form the anterior nasal spine. Okay. As you come down inferiorly, even on your own mouth or on your own maxilla, you can feel it. There is a projection upwards above your canine, which is called as the canine eminence, pointed out here. On either side of canine eminence, there are depressions called fossae. Incise the canine fossa laterally and the incisor fossa medially. So, canine eminence, incisive fossa, canine fossa. Got it? Let's take a look at it on the skull. Canine eminence, incisive fossa, canine fossa. Okay? So, maxilla has huge number of muscle attachments to it, which I want you to remember, not because I remember and I won't show you how much I remember. Not at all. I want you to remember this because in the next class, when we do muscles of facial expression, You need to know this, otherwise you will not understand the class at all. So let's go down here and see how many muscles we are able to remember. Okay. Now take a look very close to the orbit. Which is the muscle of orbit I taught you? Orbicularis oculi. So here is the attachment of orbicularis oculi. It has multiple attachments. Okay. Now there are two muscles here which help to lift your lips up. Levator labii superioris. What is it? Levator labii superioris. If it gets attached to the nose, it has an additional word to it, alic nasi. So levator labii superioris, alic nasi, levator labii superioris. These are the two muscles you will find. Below the infraorbital foramen, you find the levator anguli oris. What will it do? Levator anguli oris. Something that lifts up the angle of your mouth. Okay. Then come medially the nasalis muscles, which will control the dilatation and narrowing of your nose. A muscle here, buccinator, the muscle of your cheek is called buccinator. Incisivus labii superioris, try to remember, otherwise forget it at this point. And depressor septi. So you saw so many muscles which are attached to your skull. Okay. Revise the maxilla. Let's revise the maxilla because we learnt a lot in last 2-3 minutes. That's the maxilla. Medially bound by the anterior nasal notch. Okay. Laterally continuing into a process into the zygomatic bone, superiorly into frontal bone, inferiorly forming the superior alveolar margin of its own side, giving attachment to 8 teeth, 2, 1, 2, 3. Eminence above the canine called canine eminence. Depression medially called incisor fossa, depression laterally called the canine fossa. Gives attachment to a number of muscles, which is going to be a challenge. The muscles attached are to the edge of the orbit, the orbicularis oculi, and a number of others, which I expect you to revise before we end the class. Right. Let's now go to the last part that we need to study, the mandible. Okay, so the mandible, okay, it's the only movable part of Norma Frontalis. This is the mandible. Okay, it consists of a body of mandible and the ramus of mandible. Okay, the body has a mental foramen on it, through which emerge mental nerves and vessels, which are branches of mandibular division of trigeminal. You saw how all over the place there is trigeminal. If it's up, it's ophthalmic division. If it's in the middle, it is maxillary division. But if it's down, it is mandibular division of trigeminal, but still it is trigeminal. Okay. It shows an alveolar margin above, which gives attachment to the teeth. Okay. 2, 1, 2, 3 is the formula. I've already taught it to you. It shows an inferior lower margin. Okay. So superior alveolar margin, inferior free margin. In the middle, the two halves of mandible meet at the symphysis menti. This fuses way early, around 2 years of age. It shows a projection which is called the mental protuberance. This is the ramus of mandible, where you can see a coronoid process and a condyloid process here. It projects upwards in the form of a coronoid process and a condyloid process. A number of muscles are attached to the mandible as well. Very important muscles. Let's take a look. Let's learn it there, then we'll do it on the mandible. Okay. So here you are seeing the buccinator, the muscle of the cheek. Remember, it was also attached to the maxilla. In front of it, along the same oblique line, you have depressor anguli oris. What do you think depressor will do? Obviously, it will depress the angle of your mouth. Below that, you have depressor labii inferioris, depressing your lip. Okay, depressor labii inferioris. Then here above, you have muscle called mentalis, and then incisivus labii inferioris. So these are all muscles that are attached to your mandible, which are related to Norma Frontalis, which you need to know at this point. Okay, along the inferior margin is a muscle called platysma. Right? So let's revise. This was the upper part that we studied, then the orbit, then the anterior nasal aperture. Then we talked about the lower part, which consisted of zygomatic bone, anterior surface of maxilla, and the mandible. Okay, we've studied the Norma Frontalis. We've also parallelly done a number of muscle attachments. Okay, can I test you a little bit, students? Let's see if you have understood something. Are you ready for the quiz? Okay, so let's begin. Right, you can see the skull there and a lot of muscles attached to it and a lot of features there. See if you can answer. What is this muscle attachment? It's the corrugator supercilii. What's this? Zygomaticus major. What's this foramen? Inferior orbital foramen for the infraorbital nerves and vessels. This one, mental foramen for the mental nerves and vessels. This one, of course, I told you, above and below, maxilla and mandible, it is buccinator. This one is the nasion, the point where the frontal bone meets the two nasal bones. This one is the zygomaticofacial foramen for the zygomaticofacial nerves and vessels. This one, platysma attachment. This is the lateral or margin of the orbit, okay, formed by frontal process of zygomatic bone and zygomatic process of frontal bone articulating together. This is the ramus of mandible. That's the condyloid process of mandible. Right. With this, we come to the end of our class on Norma Frontalis. I hope you enjoyed it as much as I did. Please go back, revise it once, learn not only the features but also the muscle attachments. Believe me, it will help you in your further studies of head, face, neck. Finally, students, opportunity is missed by most people because it comes dressed in overalls and looks like work. Many times we are given opportunities, but it's too much work and we may miss it. Don't be scared, just jump into it, and it's up to you to convert any opportunity into a success. Okay? Alright, dear students, thank you very much. See you in some other video across the screen. Thank you.